Welcome back to Knowledge Talks, ladies and gentlemen. I'm your host Tariq Hilal Al-Barwani, along with our studio engineer DJ Ayub, with you here live today on Oman Radio FM 90.4. Ramadan is just few days away, and the importance of adjusting to medication is important as well. Now, I'm sure the question that you want to know about is how to do it. What is the importance of the medication? And why is it important is the subject today here at Knowledge Talk, ladies and gentlemen. Now, my guests today, ladies and gentlemen, are Hamid Namani, Mr. Hamid Namani, and Mrs. Fatma Raisi, who are pharmacists in profession and indeed are part of the Me and My Medication in Ramadan campaign. A campaign that is set to raise awareness among community about adjusting their medication during the holy month of Ramadan, in addition to answering questions and queries related to medication and administration. What is this campaign? How does it work? And why is it important for you is the subject today, ladies and gentlemen. We are accepting calls, ladies and gentlemen, on 24602058. I repeat again, that's 24602058. Now, if any of the question that I'm going to be asking today, as we always agree and how we work, if any of the question that I'm asking, please don't repeat the same question. And unless there's a question that you want to know, please call us on 24602058 if you want to know about me and my medications in Ramadan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam.
It brings me great pleasure to welcome you both today, Ustad Hamid Namani and Ustad Hamid Namani and Mrs. Fatma Raisi. You are doing a fantastic initiative, mashallah, for Ramadan. Ramadan is just next week.
Yes,
and this is really a fantastic initiative. So are we all ready?
Yes, we are. We are already prepared.
Yeah, inshallah, we are prepared. We are glad to be part of your program. Indeed, I was thinking that is it you should interview me or is it me I should interview you? I've been through your profile and I've been through your YouTube. You have 119 videos. That's impressive.
That's very, very kind of you. And the reason why, Fatma, is because we've got great talent people like yourself, mashallah, Nu'man. There's a lot of great talented people. And for me and everyone here at the studio, it is an honor to have people like you here with us at the studio. Not only to host you, but to also learn from you. Now, to start our program, I would like to first, because you are both pharmacists.
Yes.
And I would like to hear, starting with you, Fatma, on the role of a pharmacist. When you say, what do pharmacists do really?
Okay. Pharmacy is a very noble profession. It's one of the important pillars in any healthcare organization. I could say it's a completing part of a puzzle in any healthcare organization with doctors, nurses, dietitians, and all other pharmacists are very important. And I would here mention one statement that was given by His Excellency Dr. Ahmed Al-Saidi, Minister of Health, when he said in one of his interviews that pharmacists are the safeguard of healthcare profession. So it is very important because we deal with the medication, which is mostly number one intervention in any disease. Like the patients, when they are diagnosed, they usually get medication as a first-line therapy. And medications could be beneficial if used in the right way, but it could be lethal if gone wrong. That's why pharmacists are very important to make sure that the patients are taking the right medication in the right way, in the right dose, and they are following the instructions accurately. Usually, I remember when I went for my study, people were saying, why you study for 5 years just to give a medication to a person? حبة 3 مرات, one tablet 3 times a day.
5
This
years.
is nothing. Anybody can do that. But it's beyond that. Pharmacists have the knowledge about the drugs, how the drug works in the body, and what are the effects of the drug on the body, and the opposite, what the body does to the drug.
Okay.
And what are the right choices for each and every patient, because every individual have different characteristics in each disease status. And now we have such a reputation in our organization that doctors demand our presence even in the wards during the rounds, because they want us to suggest the therapy once they diagnose the drugs.
MashaAllah.
Pharmacists are now that important. And we have also pharmacy technicians, which are again a backbone of any pharmacy to do all the technical works in the pharmacy. And I don't know if Hamad wants to add anything.
Actually, the role of pharmacist, not a dispenser anymore. We consider ourselves as a patient-oriented service. We provide a patient-oriented service. We need to make sure that the medication is not only effective, as well it have to be safe.
Yeah.
And if you heard about the speciality of pharmacy, you'll be shocked. We have now very specialized pharmacy, like a clinical pharmacist. We have an emergency pharmacist, and they work in different areas. If you see, the pharmacist can work from industrial part, administrative part, and also clinical part.
Wow. So, okay. So I always was on the impression with my humble knowledge is that a pharmacist is just one pharmacist. So actually a pharmacist can have different, there is no one general pharmacist, right? No. So you have different fields in the pharmacist world.
Yes, there are many. There are community pharmacy, hospital-based pharmacy, in education, in industry, genetics, everywhere. You can find pharmacists
Different
everywhere.
pharmacists.
Yes.
Okay.
Yes.
And now, so you're doing 5 years of study to become a pharmacist.
For pharmacy technician, they need 2.5 years.
Okay.
And in Oman here, they are overqualified, so they're doing a great job.
Okay.
Then to be a pharmacist, you need to get minimum of BSc, or which is 5 years.
Okay.
Depending on the college. And you have also PharmD, and you have also a master in pharmacy. That will be very specialized, either clinical pharmacist, pharmacoeconomic, or supply chain.
No, awesome. That's very, very interesting. Now, in order to be specialized in one of the areas that you mentioned, like for instance the community and the different part of pharmacist specialization that you've mentioned, one needs to do a master's degree?
If I say community pharmacy and industrial pharmacy, hospital pharmacy, BSc would be fine, or M.Pharm would be sufficient.
Okay.
But more specialized means that if you want to do something in supply chain and take care of the drug stores, medical stores and supplies, then yes, you have to have a specialization by having an MSc in that area. Clinical pharmacy, again, you have to obtain an MSc, which usually is 2 years, and mostly our pharmacists are going to UK to obtain this degree. And then when you come again in clinical pharmacy, there are subspecialties. Like myself, I am a renal clinical pharmacist.
Okay. And what do you do as a renal pharmacist?
Yes. I used to work in Royal Hospital for 15 years, but now I'm in academia, so I'm no more practicing it. But I used to work with the nephrology team, which is the renal team, looking after the renal patients, making sure that they are taking the optimum and the best and the safest drug possible within the limited and the available resources that we have. There are no drug therapy problems with them. Doctors usually call me and Fatma that we have this patient with this condition. These are the surroundings of the patient. What do you think would be the best option? Then nursing, when it comes to nursing have to administer the drug to the patient, but what is the right way? How they have to mix the drug? How they have to give them over how long the period of time? Then the most important part, sitting with the patient. making them understand their disease status, making them understand how important this drug is to them, the compliance. We have to make sure that the patients understand how to take the drug so that they take it in a best way when they go home.
Okay. Said Hamid, you said about Omanis being overqualified.
Yeah.
What do you mean by that?
If you see some countries, when they graduate assistant pharmacists, they took like 6 months to 1 year,
Okay.
and their job responsibility will be a bit less. It's just compounding, pre-packing, and arranging the items. But we have here assistant pharmacists with 2.5 years. They are qualified, of course, graduate of Oman Assistant Pharmacist Institute. I think it's no more. Now they're graduating only pharmacists. But what they can do, they can dispense and they can counsel the patient. So that's why they considered are very qualified and overqualified.
Okay.
And they need more 2 years only to obtain a pharmacy degree.
Pharmacy degree, yeah.
Okay. And how is the pharmacist as a career here in Oman in terms of the popularity of the career and the number of Omanis who are into this role?
We are part of Oman Pharmaceutical Society, and what we need to make people understand that the pharmacist is not a dispenser.
Okay.
So, and one of the things that we need to raise the confidence for the pharmacist in order for the patient to accept the counseling. Okay, as what we have impression that the society think about the pharmacist as a dispenser.
Okay.
And this is part of the Oman Pharmaceutical Society think that they need to raise awareness and about the importance of pharmacists.
Okay. Now tell me one thing. I've just sitting with you both, the energy that I get from you is very big. MashaAllah. May Allah yazidkum khair wa baraka daiman ya Rabbil Alameen. I'm interested to become a pharmacist. What do I need to do? So the question that comes to someone who's listening to our conversation right now says, I would like to become a pharmacist. What do I need to do? What is the qualifications that is required, the prerequisite, the attributes, the character, for instance? What kind of things do...
First of all, the qualifications, if the person is just doing his 12th grade now, they have to have high score, of course, in the science sector. And then they have opportunities here in Oman that we have 2 private colleges, which graduate pharmacy technicians as well as pharmacists. And the Oman Assistant Pharmacist Institute, which is still under the umbrella of Ministry of Health, used to graduate pharmacy technicians, but now we have the second batch of second year of pharmacy bachelor degree, and they will be graduating in 2.5 years.
Okay.
That would be one of the... So if it goes through government, then Oman Pharmacy Institute is the choice. If they want to go through private, then Oman Medical College and Nizwa University are the choice.
Okay.
So there are good choices, and there are also scholarships to UK and other countries. If you talk about personality, I think it will come during the study. When they study, it will build. But one important thing, they really need to be passionate about the profession. If they join pharmacy, they really need to love to serve people. No, not medicine. No. We are pharmacists. We are the least to take medicine. But to love helping people, because that's the main thing. If patients don't exist, we don't exist.
And you have to be patient, and you need to buckle up, because it's not easy.
It's not easy.
You need to know physics, chemistry, and anatomy.
Mathematics.
It's not easy. Mathematics also, yeah.
Okay. Now, so how do you, with that knowledge that you said, and kind of subject, you need physics, you need math, and so on, how does it apply with your work?
Okay. In terms of physics, we need from drug industry. We use physics a lot in order to design the medications. We need different type of test. We need a physical test to do, and to make sure that what we call it, the pharmacokinetic of medication is controlled. in terms of mathematics, all calculation.
It's all about math and
Yeah.
chemistry. Pharmacy is all about chemistry, because all these drugs that you are using are mostly chemicals. We are combining them in the right ratio, in the right formulation to be,
Extractions.
yeah. So these subjects are very important, and these are the base of pharmacy. Pharmacy is actually a chemistry. It starts from chemistry.
Okay.
And then it goes to patient
Okay.
orientation, yeah.
Tell me one thing, Fatma. The medicines change.
Yes.
New medicine comes every once in a while, because I sometimes I try to avoid going to the hospital, but now I'll try to go and see most of the pharmacies because of people personally, like you say. I understand and I respect I've always respected it, but now I even respect it more because of how you have shared the importance of this role, mashallah. But sometimes I go and the medicines change. Sometimes the box changes, the color changes, the new version and so on. Tell me who. Tell me, is this normal? From changing it, and then also normal is one thing, and secondly is the pharmacist. Don't they need to keep on updating themselves beyond their academic years and 5 years and so on, and how do they do it?
Of course, this is very important. If you tell me, am I applying what have I studied almost 16 years back in college? Since 16 years up to now, maybe more than 300-400 new drugs came in the market. If I am not updated, then I'd better sit at home. Because as you said, it's not only drugs are changing and their implementation is changing. Today they will tell you the evidence of this drug is to use in this disease, but then after 3 months they will say, no, the evidence changed. Now this drug is no more working in this disease.
Okay.
So it's very important. But what you mentioned about the public when they go to pharmacies and they want to get some medication, say medication A. Today I went to the pharmacy, I got a medication A in a blue box.
Okay.
And after 2 weeks it was red.
Yeah.
People don't understand the concept. They think that this is different drug. No, but this could be different company, different brand, with the same drug, with the same generic drug. Different companies produce it with different names, under different color, different shapes, but it is for the same disease. And you remember we have so many incidences that patients were taking the same drug from different 3 hospitals in different shapes, and they were taking it all 3 together.
And
they come with toxicities.
Okay.
No, they don't cure. They come with toxicity because they were taking it overdose.
Oh my
So
God.
one of the things that we need the patient to know is to consider about the active ingredient or the generic name of the medication. So let's say paracetamol. This is the generic name. So whenever you go get paracetamol everywhere, you find Adol, Panadol, Omol. So different
brands,
company names. But if the patient understands that paracetamol is the active ingredient, he will find it in all those 3 companies. So he will know that it's the same drug. We try to teach this to the patients when they come to Royal Hospital. And something else, changing the boxes is only superficial. But the complexity of medications recently is challenging. The way of administrating the medications also become very complex. We have like biologic medication which need very specialized area to prepare, or very specialized area of handling. So that is more challenging than changing the boxes. So if you say insulin syringes, now we heard about insulin inhaler.
Yes.
So it's the same medication, but the technique or formulation is different.
Okay. I need to know one thing. Now, sometime you go to a pharmacy. So, of course, the people who work there, those are the pharmacists, right?
Yes.
So you go and you take some medications. You ask them, you said, I am sick, A, B, C, D. And they say, no, we cannot give you a medication unless you go to the doctor.
Yes.
So why is that they cannot? Is it because of the knowledge, or is it because of the instruction? Is it because of a rule? What can you say about that?
When you say that you are sick, first thing you need a diagnosis. Pharmacists are not eligible to do diagnosis. Diagnosis has to be done by the doctor.
Okay.
Pharmacist could advise on the appropriate therapy for that diagnosis once the diagnosis is made.
Okay.
And legally, we are not authorized to prescribe.
Okay.
But there are pharmacist prescribers internationally. There is in UK since 2004. There is in other European countries. I'm not sure about USA. Pharmacists can prescribe. So this situation, if you go to UK to a prescriber pharmacist and tell them the symptoms for simple things, they would be able to prescribe. But here in Oman, we are not authorized. Even if we suggest, the doctor is the one who would prescribe in a legal prescription, because these are legalities.
No, I respect that. And is it for all the medications or specific ones?
No, we have some medication we called over-the-counter medication. So that's medication for flu, like for pain, that the pharmacists, even private sector, that can just sell it to you easily. But what we call prescription medication should not be dispensed or given without prescription. And that, of course, right by the doctors.
Tell me, Sir Hamad, the normal day at work, what do you do?
Actually,
or a pharmacist in general, what do they do?
Actually, I'm specialized in TPN, which you call total parenteral nutrition. So my normal day is to go to hospital by 7:30, and what we do in TPN is combine 12 ingredients, all nutritions, in one bag. In order to give to the patient who cannot take the the nutrition orally. So I have a list of prescription needed to be reviewed, and after reviewing all the prescription, discussing with the doctor in case if there is an intervention, I approve all the medication. Then I follow up the preparation. But regular pharmacist, I think pharmacist Fatma can give you more.
As we said earlier, there are many different sectors. Even in pharmacy, if we give an example of Royal Hospital, it's the biggest tertiary hospital in Oman. The pharmacy sector is quite big. There is pharmacy store where they deal about all supplies. And then there is pharmaceutical care department where they have outpatient pharmacy dispensing medication for patients who are visiting the clinics or coming from home to take their repeated prescription. Inpatient pharmacy where they deliver drugs to the patients who are in the wards. And we have a drug information center where they take care about all the information coming from all healthcare professionals, from patients. And then there is the preparation unit where Hamad works. One of the units is TPN, total parenteral nutrition. The other unit is chemotherapy, where they make the oncology drugs for cancer patients. And there is clinical pharmacy looking after inpatients, and in different sectors we have pediatrics, we have pharmacists looking after cardiology patients. As I said, I was in the renal unit, and there is ICU pharmacist. So these are different sectors, and usually everyone have his own set of duties and responsibilities.
If you were to tell me the kind of skills that you would tell people not to join pharmacies, I mean, this is the kind of habit or skills that a person has, and then you feel that with this kind of skill set or attribute, you should not join pharmacy, what would that be?
Actually,
not patient to the customers, maybe.
We urge people to join pharmacy, so we don't want we don't want to scare them.
You guys are very good. I respect that fully. So you want everyone to be joining. It's a very good family, and you want people to help more people.
And I think skills can be obtained at any level. And
but maybe math, if they're not good in math, or pharmacy.
That's the entry level. If anyways they are not good in these subjects, they won't get acceptance.
It's a challenge. Math, chemistry, and also standing for 6 hours or 7 hours study.
I know, but we will urge people, especially those who are, this is my message to the 12th graders. Pharmacy profession is amazing profession. And I'm sure if you know more about it, you'll love it. Work hard a bit for these days when you're going through your exams, and I'm sure you will make it.
Inshallah. Ladies and gentlemen, we're going to take a quick break and revert to our interesting discussion today with Hamad and Fatma. Exciting discussion today with Mr. Hamad al-Namani and Fatma al-Raisi, whom are pharmacists and have shared before this music break about the importance of the role, how does it work, how can you also become one, and also the process it takes for one to get a medication from a pharmacist. Right now, ladies and gentlemen, we would like to know about this exciting campaign which will be starting during the month of Ramadan, which is known as Me and My Medications in Ramadan. Fatma, please tell us about the Me and My Medications in Ramadan.
Well, Me and My Medication in Ramadan is a campaign which is organized by many parts. It's not just one sector. It's the Oman Pharmaceutical Society, which represents all the pharmacists. Yet there are other departments, such as the Directorate of Rational Use of Medicine in the Ministry of Health, the Director General of Pharmaceutical Affairs and Drug Control, pharmacy sectors at various hospitals, such as Royal Hospital, Khawla Hospital, and Al Masarra Hospital, and the Oman Pharmacy Institute, where I work, and the Director General of Muscat region. And the event will be under the auspice of His Excellency Dr. Darwish bin Saif al-Maharbi, the Undersecretary at the Ministry of Health for the Financial and Administrative Affairs. The event will go on the 2nd of June.
So next week?
Yes.
Is it before Ramadan?
Yes.
Okay.
In Avenues Mall.
Okay.
And it will start at 5 p.m. to 10 p.m. inshallah. And this is only the start, but then it will continue in the hospitals and in other regions. And this campaign is actually about the awareness to the public about using their medication wisely and safely and effectively in Ramadan.
Okay.
What happens that the patients usually deny going back to healthcare professionals, and they make their changes of drugs by their own.
Okay.
And there are many international studies show that more than 50% of patients change their medication without going back to doctors or pharmacists, but then they end up with adverse consequences, side effects or deterioration of the disease status. So this is very dangerous. They have to go back to the doctor or the pharmacist so that they make adjustments for their doses and the duration of the drug so that they take it in the best possible way. And this is the campaign to raise awareness in this aspect to the public.
Okay. And this event will start, you said on 2nd of June, and it will be throughout the Ramadan.
In different areas, yes.
In different areas.
Yeah, in avenues it will be only for one day, but then it will take part in other hospitals. And there are already hospitals in the region like Rustaq Hospital, Ibra Hospital. They already started the campaign.
Oh, awesome,
Yes,
awesome,
yes,
awesome.
yeah.
And how are you promoting this event?
Well, actually, Oman Pharmaceutical Society have their Twitter account and Facebook.
Okay,
you
very
know,
good.
so you know the social networking.
Oh yes, very
So,
powerful.
Yeah. Also, we have like 400 members on Oman Pharmaceutical Society, so we send them emails, and also we have a group, WhatsApp group. We keep sending, and which is also spread through other WhatsApp group, pharmacy WhatsApp group.
Okay.
Yeah.
Okay. That's very, very awesome. Ladies and gentlemen, we are accepting calls on 2460-2058. If you have any question pertaining to our discussion today with Fatma and Hamid, 2460-2058. And who are your targets, by the way?
Our targets are all the public, all the community, and especially the people who are taking drugs for chronic diseases.
Okay.
We have lots of patients for their diabetic, hypertensive, cardiovascular diseases, patients who had transplants, different organs, and patients with other chronic diseases like epilepsy. And even this is, of course, the chronic, but on the other side, even patients, if they get sick for a small period, like with an infection, they will need an antibiotic. How would they modify it? Would they fast? Would they not fast? These are all the issues. And of course, as you know, as Muslims, we do care if I'm taking an eardrop, it will break my fast or not. If I'm taking an injection, it will break my fast or not. But these are all related to questions by the right people, which are the we also invited in this campaign from the Ministry of Religious Affairs.
Okay.
So there will be a representation from them, and they will advise the people on these. There will be a scholar who will answer the questions about the legality issues and whether the drugs in certain routes will break their fasts or not. We are also having other parts.
Yes, we invited dietitians in order to give advice on the food habit during Ramadan. And we also urge the patients when they come there to bring their prescriptions in order for us to know their medications and to give the proper advice.
Oh, very good.
Yeah,
So,
it's not only about medication. Also, we need them to know about their disease, and like especially for diabetic patients, we need them to know if their blood sugar is lower than usual, what the symptoms and how to act in order not to go in a very severe hypoglycemia.
okay, no, that's very, very exciting. So anyone can come during this event, which is going to be on 2nd of June. They can bring their prescription, their medicines, and they can come even to speak about their diseases, and you will be guiding them on what is the best way to utilize medications during the holy month of Ramadan.
Yes, as I told you, there are many parts. There will be many pharmacists there.
MashaAllah,
With
very good.
different specialities. They can guide the patients. And don't worry, we'll take care of their kids as well. We are running fun entertainment, something for the kids, so the kids will be
Awesome.
busy,
Okay.
and the parents could come to us and have
Focus
some
on
talk.
Yeah.
And there are so many surprises as well.
Awesome, nice.
There will be a draw on air tickets to Salana.
MashaAllah,
so they
awesome.
can take part in that as well and win. So
So a lot of
everyone
exciting
is
things there.
everyone
So
is
they don't have an excuse when they say we have kids and there is no place to take them.
yes.
Yeah, and this is really exciting. This is very, very. I will come to. Now, what I want to know is it's free, obviously.
Yes, of
Yes.
course,
So
it's
it's
free.
open for the
Yeah,
public.
yes.
It's free education, free knowledge
yes.
sharing that you are doing for the society, for the betterment, obviously, for the people and the society as well. Now, how you told me that you're going to be for some days in Avenue, or is it for the whole month?
No, for in avenues only one day.
One day. So now how can I too know about all your schedule? Where are you going to be so that I can be chasing you and following you all the places that you go?
Actually, the best place to target the patient is the hospital.
Okay.
So because when they will come there. Now, what we do on Thursday, there will be the public campaign, and
Okay.
all the leaflets and the material we have, it will be spread to different hospitals,
Okay.
and it will be in all the pharmacy in all over Oman. We have Sendem, Sohar, Rustaq, Ibra, even to Salala.
Okay.
We're gonna spread all the material to there, and we're gonna urge the pharmacist to counsel the patient according to those leaflets, and to give those leaflets in order to have this awareness about the medication in Ramadan.
As well as if you want to chase us, it's chasing any pharmacist in any healthcare facility. They will be willing to provide information, because we already what the Pharmacy Society did as well. They made a presentation about educating the pharmacist as well before the event, so that they are prepared with the
Awesome.
knowledge enough to give it to the patient.
Awesome.
And it's going to all the pharmacists who are reading this and preparing themselves to get the questions from the public. So if you go to any pharmacy, they will be prepared to answer your queries about your medication.
Okay. Well, that's very awesome. Now, tell us about the timing of drug administration and its importance.
Yes, okay. Drug administration is very important, and if most of the patients would take drugs for chronic diseases, if they are taking it once daily, they shouldn't be much of concern. Because once daily would be like, if the patient is taking once daily drug at morning, then they can shift it to dawn before starting the fasting.
Yeah.
But then here comes another issue. Is the drug having any problem with circadian rhythm? Circadian rhythm means that there are certain chemicals in your body represent in certain time. You have to target them at that specific time. If you change the drug, it won't work that efficiently. So these issues, who will tackle it? A pharmacist.
Okay.
They will be the right person to tell you whether yes, you can shift your dose to another time or not. But mostly once daily would not be a big problem. But coming to twice a day, as you know, fasting varies according to seasons, from 11 hours to up to 17 hours in some countries.
True.
And this year we might be fasting for 15 hours. The problem is that if your drug has to be taken every 12 hours, but you are fasting for 15 hours, how would you manage that?
Okay.
There is a study for some patients who were asthmatic and they were taking tablets that should be taken every 12 hours, but they changed it without going back to doctors. And what happened? They suffered lots of side effects: vomiting, headache, nausea, abdominal pain, because the gap was not consistent, and sometimes they had to take the drug every 8 hours and the other day every 12 hours.
Okay.
Yeah. So this is a problem. If they would have come to a healthcare professional, we could have changed it to a drug like sustained release tablet, which can be given once daily only. So this is how we modify their drugs. And if the drug is 3 times a day, that's even worse, because now you have to take it every 8 hours, which is not possible in Ramadan. So either we help the patients to change to another drug which is more suitable with the Ramadan fasting timings, or we urge the patients not to fast because they have to take their drugs.
Okay. What makes Ramadan different when it comes to medication administration, Hamid?
As Fatma said, you'll have 15 hours gap without unable to take your medication. Of course, not all medications.
Okay.
Switching the medication without consulting a pharmacist or a doctor may lead to a high risk. It can cause damage more than its effects. One of the things that maybe the patient is not aware about is not only changing the timing. Some medication, if you took one or more than one medication, there should be a certain gap between those medications. So if you just switch the medication by yourself, you might reduce this gap, and it kind of goes interaction between those medication.
Okay.
So that's why we need to know the full medication you have, the medication that you already bought from the pharmacy and using without it's not in the list, in order to give a good judgment.
Okay. Now, if you would advise people, just in case for people who are listening to our program today, that whoever would like to come and attend this program and events, is that they need to come with their medication, so that you can help them on how they could use the medication the right way during Ramadan. Is that right?
If they bring their prescription, that's fair enough. If they know their medication, that's fair enough by name, because some people, they will come and tell you, I take that blood pressure tablet which is round and white. There are many round and white tablets, so we better know the name. Or if they bring the prescription, that would help the most.
Okay. Yeah, I like that. Why did I laugh? Is I think I might be one of them. You know that I'm using the round one. You know the round one, which is that when I got a headache, I just eat that. You don't know which one. So it's true. So they need to say exactly what is it. Otherwise, you might give them the wrong medication. Now, if I were to ask you to tell me what are the most frequently asked question from the public about medication, what would that be?
Usually, lots of the questions that come to us, which drug makes my fast breaks? And that's why we thought, no, this time we have to target the right people to answer these questions.
Okay.
Because you can't just do an ifta in something you don't know.
Sure.
And so that's why we are bringing this time, as I said, people from the Ministry of Religious Affairs they would be more authorized to answer such questions.
But the Ministry of Foreign Affairs?
No, religious
Affairs, sorry.
Yeah.
So now
Did I say it foreign?
No. So from religious affairs. And now from the religious affairs, how would they know? Would they need to be specialized in medication, right? Otherwise, they'll talk about religion.
It is the religious aspect with the medical
based.
it is scientific based, because there was a scholar and meeting in Morocco some time ago where they sit with so there were doctors, healthcare professionals, and the religious people, where they did make the list of medicines that would break the fast, and the list that it won't. So, but they would be even the right person to answer. We can help scientifically. We can say scientifically, like, if you take a ear drop, it won't go to your GI system, so it won't break your fast. And they will bring the religious prospect of it.
Okay.
And what was the other?
And they have done a good job. I saw some leaflets print out. They spread it annually each year before Ramadan, which contain different medication, different formulation, and it shows that this medication, this formulation, can break your fast or not.
Okay. Can you give me an example of a question in which someone have asked and then you got in a religious person to respond to?
Insulins? I think most of the time insulin injections, they ask if it does break their fast or not.
And
what's
as
an
well,
insulin?
Insulin is a natural hormone in your body that regulates your glucose level,
Okay.
and usually used in diabetic patients.
Mhm.
Patients with diabetes do use this medication. Type 1, and if not controlled, even type 2 later on at some. So this is one of the drugs. And the other question that comes more frequently about the fluids, the IV fluids. That comes a lot.
What's
that
an IV?
IV is a fluid that be taken through the vein.
Okay.
Because the
Vein,
patients are not being able to take orally, so they give them fluids through the intravenous route, and they would say it's like مغذي.
Okay.
It's like a food, so it will break my fast.
Nutrition.
So, and then we have to go to the religious people and make sure that we would give the right advice to the patient.
Okay. Oh, that's really awesome. It's really awesome. I'm very pleased that this such initiative is available over there. So you could bring it up to a lot of people here in the public to learn about it. Personally, I would love to learn it as well. Nothing beats having a knowledge on how to use your medication in the right way and in the best way to do it. Is there anything that you wish to share to our audience today?
Yeah, I would invite everybody who's listening to attend this campaign, and please bring in your friends and families as well. There is lots to have enjoyed with as well as learn, and special thanks to our sponsors without whom the event would have not been successful: Oman LNG, Oman Air, and Abraj al-Zahra publishers, because these were the sources of our fund to run this campaign. And of course, special thanks to the Ministry of Health and the Oman Pharmaceutical Society and all the pharmacists everywhere for supporting us to run this campaign and many other campaigns. And I would really like to thank you, Tariq, for hosting us in this program and being able to spread the knowledge about our profession that we love the most and passionate about to the public, and as well as invite them for this campaign.
In fact, it goes, truth be told, is that it is my honor to invite you both today, because not only I've got a very good friends today whom are pharmacists, which I'm very, very happy. Everyone who's listening today have got a very good knowledge from you, very good learning, because you have explained it very simple, in a very simple English and basic that everybody can learn. I don't know about pharmacy, but now, alhamdulillah, at least I've got a knowledge. When I see pharmacies, anytime I go to the hospital, I remember Ustad Hamid and Fatma straight away. So thank you both. Thank you both. And I wish you the very, very best at all that you do. And the campaign, inshallah, to be a successful one, inshallah.
Inshallah. Thank you.
Okay, ladies and gentlemen, we've come to the end of our program for this week. I hope you all had an intriguing time with us. Let us catch up again, inshallah, after Ramadan for Knowledge Session. I am Tariq Hilal Al-Barwani, along with our studio engineers, wishing you all a happy and a pleasant week. Ma'a salama.